This is Dari. Are you ready? Stay tuned. Stay locked right here on Smooth 98.1. Thank you. It's your Smooth Drive Home. Just keep it on your radio.
The Smooth Drive Home on Smooth 98.1 brings the biggest tunes and information your way.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1, love music, love life. Welcome to the program. If you just joined us, you are just in time. Today we're going to be having an interesting conversation that I think every single person out there, you're listening to the radio right now, possibly in Nigeria, should be aware of. We're talking all about diabetes, and we'd love for you to be a part of our conversation. Don't forget, we're giving out vouchers courtesy Evercare Hospital on the show today. So I'm giving vouchers to our first 3 callers or texters, and to be a part of our conversation, please call the number call the number 014489981 or send a WhatsApp message to 0809444091. Like I mentioned, we're talking about diabetes and what you need to know. And in the studio today, we have a very special guest to take us through it. Our very special guest is Dr. Chinyere Udo. She is a dedicated and competent consultant physician and endocrinologist. She currently works as a health provider with Evercare Hospital, Lekki. Also, she has a broad knowledge and hands-on experience in the management of metabolic diseases such as diabetes mellitus and obesity, as well as core endocrine hormonal abnormalities. She's also committed to making a positive impact by offering evidence-based, humane, patient-centered care. Now, Dr. Chinyere is a fellow of the West African College of Physicians, and she has an MBBS degree from the University of Nigeria, and also had a postgraduate medical training at the Lagos University Teaching Hospital. She's also a member of the Endocrinology and Metabolism Society of Nigeria, and she's here with us in the studio today. Good afternoon, Doctor.
Good afternoon.
Great to have you here.
Thank you.
All right.
It's my pleasure to be here.
Good to have you. So, Lagos, like I mentioned, we're giving out vouchers to our first 3 callers. So please call us and let's have that conversation. So, Dr. Chinyere, please, let's jump right into it. I'm sure a lot of people are wondering, who is an endocrinologist and what does an endocrinology physician do?
Right. So, thanks for that question. Who is an endocrinologist? I think that's actually a common question I've heard, in my line of work. Sometimes people go endo what? So basically, an endocrinologist is a physician that specializes in treating diseases that are hormone related.
Okay.
So there's a wide range of illnesses, the most common being diabetes, patients that have thyroid issues, obesity, things that have to do with the adrenal gland. Sometimes patients that also have pituitary, that's one of the organs, that's one of the glands in the brain that produces hormones as well. So if we have issues with that hormone, that's what we call pituitary issues. Those are also patients that the endocrinologist sees. So basically a wide range of hormone-related things, including reproduction.
Okay.
So basically, the endocrinologist also sees things that have to do with nutrition.
Okay.
In fact, by now we're saying we should add nutrition to what we do.
Nutrition, diabetes. Okay, so that's quite a number of things that you do.
Yeah, it is.
Okay, so the World Diabetes Day is November 14, and this November 14, 2021. That's why we're having this conversation. But I'm sure a lot of people are wondering, and of course I'm also wondering, why do people living with diabetes need to see an endocrinologist?
Okay, so like I said earlier, endocrinologists actually see patients that have, or people that have issues to do with hormone, so hormone-related illnesses. Chief amongst those in our environment is actually diabetes, because that seems to be the most common hormonal abnormality. So the endocrinologist is actually positioned to be able to manage the patient that has diabetes.
Okay.
Because at the core of diabetes as a problem is insulin. So problems that have to do with insulin. So insulin is the hormone of concern here.
Okay.
So the endocrinologist has the training to coordinate the management of this patient with diabetes. Of course, it's difficult for the endocrinologist to do it alone. So usually patients that have diabetes can actually be seen by general physicians, medical officers, but sometimes some of those patients might need an escalation of their treatment.
Okay.
You might need to optimize their glucose control.
Okay.
Or sometimes they have complications and you need the expert physician to come in, and that's where the endocrinologist comes in.
All right. Lagos, like I mentioned, if you've got questions for our doctor, if you know someone living with diabetes, or you've got questions and you have some, strange feeling concerning diabetes and you want to, ask the doctor, well, now's the time to do that. So please call the number 0144899981, or better yet, just send us a WhatsApp message. WhatsApp messages come to 0809-444-0981. So like I mentioned earlier, November 14 is World Diabetes Day. Please, doctor, tell us, why is it important to, raise awareness? That's the best word I'm looking for. I'm just looking for the right word to coin it. Raise awareness about diabetes. And also, is Evercare doing anything to commemorate this notable day?
Okay, so thank you again for that question. So when we talk about diabetes, November 14th is actually been a date that's been set apart, not just this year, but that's a date that's been set about to create awareness, like you said, about diabetes. So now, why do we need to create awareness about diabetes? Diabetes is actually it's a very common disease.
Yes.
Now we talk about pandemic. Diabetes is actually a pandemic at this point. There's the International Diabetes Federation, IDF for short, which has some statistics on diabetes I think are quite relevant. So as of last year, 2020, from the statistics, you have up to 460 million people in the world living with diabetes, adults aged between 20 and 79 years. And we're talking about just type 2 diabetes, because there's type 1, there's type 2, there are other types. But if we look at type 2, that is the most common, takes up to 90% of the cases.
90%?
Yes, it's made up of type 2 diabetes. As of last year, the statistics was 460 million worldwide. But that's not the only frightening thing. The frightening thing is that it's actually projected that by 2045, 700 million people will be living with diabetes, and that's huge.
And 2045 is not too far away.
Yes, it's not too far away. And then if you look at the statistics by region, Africa, which is underdeveloped, actually is projected to have a 143% increase.
Oh, wow.
So that's almost like a triple increase from where we are. So if we think diabetes is common at this time, we're looking at a pandemic that is getting worse. So if you bring it down to everyday numbers, you would say that for people over the age of 65, 1 in 5 of them have diabetes. And that's quite significant. And then out of people that have diabetes, out of every 2 people that have diabetes, 1 person does not know that he or she has diabetes. In other words, that person is undiagnosed. And even among the people that we have diagnosed, they know they have diabetes. More than 50, almost up to 50% of them do not reach the treatment goals. So, what this actually spells out is that with diabetes, there's a lot of unmet needs in diabetes. And so that spells out the need to create awareness about diabetes, about diagnosing it, and about the fact that when you make a diagnosis, there's care. There's access to care. There's a whole lot that we can do to make the life of the person that has diabetes better. So in 2021, diabetes is no longer a death sentence. 100 years ago, if someone had diabetes, especially type 1 diabetes, the person was almost sure to die. But 100 years ago, insulin, which is the hormone that we said is central, was discovered. In fact, this year, the world is celebrating 100 years of insulin, which is a huge milestone. So there's hope for the person that has diabetes. But you need to know that you have diabetes first to even be able to access care And that's why we're creating the awareness. So November 14th has been set aside, and then this year in Evercare,
yes,
we're actually doing something to commemorate the day. November 14th of this year falls on a Sunday, which is not a work day. Yes. So we're looking at Friday. Sorry, just trying to pick up the dates. So we're looking at
November 16th?
Yes, Friday, November 16th. Okay, Friday.
I think Monday is November 16th. Okay. But yes. But generally, Evercare is celebrating.
Yes, World Diabetes Day. So we're looking at celebrating that on Friday the 19th. Friday the 19th.
Okay.
So it promises to be an enriching encounter. We're going to have talks about diabetes prevention, what you can do to make life better. We're going to be doing free screenings, free metabolic profiling, so people know what's my risk for having diabetes and what can I do to prevent actually having diabetes.
Can we reiterate that again? So Evercare is doing free screening?
We're doing free diabetes screening.
Okay.
We're doing a free metabolic profiling. And then also we're doing a risk assessment.
Okay.
So I don't have diabetes, but what's my risk?
Okay.
So if you know your risk, you know how actively you can prevent it. And then for people that do have diabetes, we're also talking about how can you cope with this chronic illness? What are the things that you can do? So it promises to be a stimulating session.
All right.
And then we're also training an aerobic section, which should be fun. So yes, Friday the 19th is the date at Evercare Hospital.
All right, thank you so much for that, doctor. Now, speaking of diabetes still, I'm sure that a lot of people out there are wondering, what is the main cause of diabetes?
Because when it comes to diabetes, like I reiterated earlier, there's type 1, there's type 2. So most of our conversation is going to be around type 2 because, like I said, that's the most common type. For type 1, which I'll just mention briefly, the main cause is usually that this person's body actually is not producing enough insulin.
Okay.
Usually because there's been a process that has destroyed the organs or the glands that produce insulin. And so this person is insulin deficient. And insulin, in very simple terms, is actually the hormone you need to open the key to be able to use the glucose in our bodies. So when you eat and the food gets broken down to glucose, we need to be able to use this glucose. So if insulin is deficient, the person will not be able to use this glucose in the cells, in the muscles, and then the glucose actually accumulates in the blood. And then we say the blood sugar is high, the blood glucose is high.
Oh.
And that's diabetes. So in type 1, the person that has type 1 is just not producing insulin. In type 2, which is the more common type, this person at the beginning actually is able to, and for quite a lot of people, is actually able to produce insulin. But what happens is that the organs that actually are supposed to respond to this insulin are resistant to it. So the muscles, the fat tissues, the liver, even though the insulin is there, they are not responding as well as they should to the insulin. And so glucose accumulates in the blood. And then this person now comes down with signs and symptoms of diabetes. So for type 2, we say that the cause is usually a relative insulin deficiency. Or in other words, we say there's insulin resistance, meaning that the organs that are supposed to respond to the insulin are not responding to it. So that is central to what causes type 2. But beyond that, in talking about what causes it, type 2 is also determined by genetics.
Okay.
So some people that have a family history, someone in the family has diabetes, the person is actually more likely to have it than the other person in the general population.
Oh, wow.
So yes, our genes play a role. Now, the big news again in causative factors for diabetes is that for type 2, our lifestyle plays a huge role. So the things we eat, our body weight, our lifestyle in terms of whether it is sedentary or active, actually plays a role in causing this. So if you look at type 2 diabetes, it's a multifactorial thing. So there's so many things, okay? So it's not a 1 + 1 = 2, but so many things that need to be there to actually set the stage, for this disease to occur.
For type 2 diabetes now, I'm wondering, and I've heard a lot of people ask this question, so I thought I'd just ask you now, speak the minds of a number of people. So fizzy drinks, right? Could they be a cause for type 2 diabetes?
Okay, so when you say fizzy drinks, I'm sure we also usually refer to the sugar in the fizzy drinks.
The sugar in the fizzy drinks.
Okay, and then sugar across board, other things that we eat.
Yes.
Okay, so eating too much sugar, it can play a role, but it's not a 1 + 1 = 1. So people tend to say, if I eat too much sugar, I'll have diabetes. It doesn't really work that way. But how does sugar become a culprit in this case? When you eat a lot of sugar, whether it is in form of the fizzy drinks, whether it is in form of the quick snacks, or whether it is in form of too much caloric intake, what actually happens is that the body breaks down this, and then the excess is stored as fat in the body.
Okay,
and then the person that takes a lot of this is more likely to gain weight. Okay, and then we talked about fat that in type 2 diabetes, the fat cells are resistant to insulin.
Okay.
So when you have more fats, being stored, fat that you don't need, just lying there dormant, it increases insulin resistance and makes the person prone. So it's not a direct causative factor, but yes, it can play a role.
It can play a role.
Yeah, it can. Again, some studies have been done over time, actually have established a link between people that take high glucose intake and diabetes, not just even without the factor of adding weight. Okay, so observational studies have just shown that yes, people that take a lot of sugar could be at risk. But like I said earlier, diabetes is multifactorial, so you need other things to also play a role. So if, for instance, I have a genetic predisposition and I'm also high on the fizzy drinks, gaining the weight, then I'm practically on my way there.
All right, thank you so much for that, Doctor. If you just joined us, this is Smooth Health. It's brought to you by Evercare Hospital. If you just joined us, we're talking all about diabetes and what you need to know. And like I mentioned at the start of the program, we have Dr Chinyere Udo. She is taking us through this conversation. She's a consultant physician and endocrinologist. Bit of a tongue twister there. But she's with Evercare Hospital. So I've got a message here from Folu Agoy. But before I read this message, also if you're out there and you've got questions for our doctor today, please send them to 0809-444-0981 or just call the number 0144-89981. Okay, so here's a question from Folu. Folu says, hello, doctor. Please, I'd like to confirm the nutritional value of wheat. Some doctors warn diabetics against its consumption for its propensity to aggravate and complicate the condition. Okay, so Java, what are your thoughts about this?
Okay, so wheat and diabetes. Okay, so let me just combine this with a popular notion too that I've heard out there. People think that if you have diabetes, you have to be on a special diet, and most times people include wheat in the so-called special diets.
Okay.
But the truth is that the person that has diabetes does not need to be on a special diet per se. So this person needs to be on a diet that is healthy, low fat, low calorie, high fiber, not necessarily wheat per se. So wheat on its own, it's not the recommendation. If the person likes wheat and tolerates wheat, because some people actually react to wheat, especially some of the things in it like gluten. So if the person does not like wheat, he doesn't have to take wheat. For someone that tolerates wheat, likes wheat, the person can take wheat. But central to whether it's wheat, whether it's semo, whether it's our local eba, is portion control. Portion control. So if you eat a lot of wheat, it's still going to get broken down to glucose, which doesn't help the diabetes much. So sometimes it's not about whether it's wheat or whether it's about any other complex carbohydrates. We want you to, as much as possible, eat the food you like, but stick with the complex carbohydrates that are healthier and also have a lot of fiber and generally a balanced diet, low fat too, basically.
All right. Thank you so much for that, Doctor. Let's go on a quick break. When we get back, we'll do some more talking. Don't forget, you're listening to the Smooth Health right here on Smooth 98.1. Of course, Smooth Health is brought to you by Evercare Hospital. Stay with us.
Smooth Health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
There's nowhere on this earth that compares.
Smooth.
Hey guys, my name is Rachel Kerr, and let me tell you about my Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside suya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in my Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Welcome back, Lagos. This is still Smooth 98.1. Love music, love life. If you just joined us, this is the Smooth Health Show. Of course, it's brought to you by Evercare Hospital. And today we're talking all about diabetes and what you should know about diabetes. Now, we have a very special guest in the studio, Dr Chinyere Udo. She is a consultant physician and also endocrinologist with Evercare Hospital. And so far, we've talked about why do people with living with diabetes need to see an endocrinologist? And we talked about, the Awareness Day, which is World Diabetes Day, which is the awareness that Evercare is also doing on the 19th. And we've talked about the main causes of diabetes. Now, let's circle back and talk about signs to watch out for. So, doctor, in your opinion, what are the signs to watch out for? As far as diabetes is concerned.
Okay, so the most common signs for a patient that has diabetes, especially at the beginning when it's not been diagnosed, is person would notice that he or she is getting testy quite a lot. So there's excessive tests.
Okay,
and then there's also excessive passage of urine. So the person keeps urinating. Okay, weight loss. Okay, so I'm feeling testy, I'm peeing a lot, I'm losing weight, and then the person also starts feeling tired, fatigue. Some people would also notice that apart from all this, they have recurrent infections, usually yeast infections, candida in the mouth, in the private parts. Some people also have boils, but generally recurrent infections. So if someone has these symptoms, has boils, okay, that person actually needs to screen for diabetes. Some people also may not come down with classical symptoms, but they're actually picked up at the point of doing a screening, maybe like a general wellness test or a public health screening, and the blood sugar is done, and then the person picks it up. So those are the classical signs or symptoms that the patient with high blood sugar would have. Okay, and that preempts the screening. But having said that, because we know, like I said earlier, some people don't have those classical symptoms, so it's good to also do wellness checks, do annual checks, and it can be picked up incidentally during those checks, especially for people that have family history, especially for people that also have that overweight or obese, which are risk factors for diabetes. So that person could screen and can be picked up.
All right. Earlier we talked about, fizzy drinks, and I want us to just quickly circle back on that for the benefits of those who just joined the show, right? I asked the question about eating too much sugar. So I'd like to ask you this. Can eating too much sugar make, a person a diabetic? If yes is the question, then how does sugar generally affect diabetes?
Okay, so it says eating too much sugar on its own as a single factor, it's not a cause of diabetes. However, it can play a role, especially if this person already has a stage set. So for instance, a person has family history of diabetes. Okay, a person has a less than active lifestyle, sedentary lifestyle, and this person also takes a lot of sugar. So you see, there's already a stage that is set, and then this taking sugar will now serve as something that worsens it, because when you take a lot of sugar, the body is going to store the excess as fats, and fats excess fat in the body is actually known to show insulin resistance, meaning that the excess fat will make the insulin not to be as effective as it should be.
Okay.
And when we have problems with insulin not being able to do its job well in the body, then the blood sugar goes up because the insulin, the body is not able to use the glucose it has. So to that extent, taking too much sugar could play a role, but usually does that together with other factors. So diabetes is multifactorial. Okay.
All right. Thank you so much for that, doctor. Don't forget, if you're out there and you've got questions for our doctor, feel free to send us those questions now. 0809-444-0981. Plus, we're giving out 3 vouchers, okay, courtesy Evercare Hospital for your first consultation, to any type of consultation, basically, to come just check yourself and, understand your general well-being. So first 3 callers, first 3 texters, we're giving out messages, we're giving out vouchers rather to those people. So 0144899981 or 0809-444-0981. Doctor, let's talk about types of food and also fruits that are recommended for people living with diabetes. So what types of food would you recommend, and what types of fruits would you recommend?
Okay, so when it comes to foods and people that already have diabetes...
Just before you launch into that, let's quickly see what this person has to say. Hello? Hello? Hi.
Good evening.
Hi, good evening. What's your name, sir?
My name is Muiwa.
Say again?
My name is Muiwa.
Okay, Muiwa. Do you have a question for the doctor?
Yes. I refer to what you said about frequent urination as a sign of diabetes. I want to confirm, like in my own case, during the day, I don't have the urge to urinate at all. Just the normal. But it happens more when I sleep. As in, sometimes 3, 4, 5 times before the day breaks. Is this normal, or does it have to be a certain time of the day, or that's just it?
All right. Thank you so much, Muiwa. Doctor?
Okay, so thanks, Muiwa, for your question. So in talking about excessive urination, passing too much urine, okay, in diabetes, it may not necessarily be limited to the night. This person just finds that passing urine a lot, frequently. It might be in the day, it might be in the night, so it cuts across board. But having said that, that's not the only thing. It's not taken in isolation. Apart from passing frequent urine, plenty urine, as we say in Nigeria, this person also has other things: feeling thirsty, losing weight, feeling tired. So it's a whole combination of things.
Okay.
And then when it comes to just urinating, there are other things that can also make a person urinate frequently, not just diabetes. Okay, it could be things that have to do with the prostate. It could even be an infection. So many things. So if in doubt and you think you're passing too much urine, it's good to screen. The screening for diabetes is pretty simple and straightforward. Okay, so you could just check your blood sugar and then you would know, okay, is this from diabetes or is this something else? So it's one of the things that a person could have, but the sure thing is to get a screening done.
All right. So, Muiwa, I hope that you've been able to take that down. So, doctor, real quick though, you wanted to tell us about food and fruits to eat.
Okay, so food and fruits to eat.
Okay.
There's really no special diet for the patient that has diabetes. We can't reiterate that enough. Our local African foods that have a lot of dense carbohydrates that the body takes time to digest are better. Okay, and so we actually have we encourage the person that has diabetes to talk with a dietitian, talk with an endocrinologist, talk with a certified nutritionist, okay? And then we'll work with the foods that you like to come up with what is good for you. So our local African foods in controlled portions are actually healthy enough, better than processed foods and better than Western foods. So when it comes to the fruits, a person with diabetes is actually encouraged to still take fruits, moderate intake, and especially foods that are high in fiber, foods that are generally talking about foods, high fiber, low fat, and especially trans fat and saturated fats. Of course, quit smoking. Okay, so those are really the things. So no esoteric diets, still our general foods, but we look at each food. There's something we call we look at how quickly that food breaks down into glucose after you've eaten. So we want the ones that your body takes its time to digest, and we take them in controlled portions pretty much. So there's no special diet called a diabetes diet. That's the point I'm trying to make.
All right, real quick, doctor, because we're almost out of time. How can individuals test for diabetes? That's one. And also, what types of treatment options and equipment are available at Evercare Hospital for this disease?
Okay, so testing for diabetes is easy. It's a blood test that we'll do, and then we're actually trying to screen for the sugar in the blood, glucose specifically. There are also other tests that we can do that can show the average blood sugar glucose the person has had in the past 3 months. So all these tests would actually tell us if this person has diabetes or not. So when it comes to treatment options, there are a whole variety of treatment options. Treatment options for diabetes actually starts with lifestyle, what we call lifestyle modification. So we look at the food, that's your diet. We look at also increasing your physical activity.
Okay.
So all those are lifestyle interventions. And for some patients with diabetes, that's enough to keep the blood glucose in control, even if it's just at the beginning. So for patients that are not able to get good control on that, we move on to medications. There are a whole lot of drugs, for the patient that has diabetes. And the endocrinologist will look at this, situate the patient, and be able to individualize the treatment. So out of this so many drugs that we have, which one works for this patient best, or which one is indicated. And then for some patients, we also have insulin. Like I said, we're celebrating 100 years of insulin, wonderful medication. And because of that, the person that has diabetes has options. In Evercare, we actually have a team. So it's not just the call of the endocrinologist. For patients that have diabetes that would have developed complications, we actually liaise with the eye doctors, the ophthalmologists, the kidney doctors, the cardiologist, the dietitian.
Okay.
So it's a whole thing available at Evercare to take care of both the person that is newly diagnosed and the person that has had diabetes and has complications as well.
Okay.
So it's a team thing. We also have equipment, so we can screen for complications. We can manage those complications as we pick them up.
All right. Thank you so much, Doctor. I wish we could go on and on and on with this conversation, but if you just joined the show, you've missed a ton of good stuff already. We've been talking about diabetes and what you need to know about it, because you do know that World Diabetes Day is November 14th. It's on a Sunday, but Evercare is doing some type of awareness, come the 19th, basically. So there's going to be some free screening amongst other things, and you should make your way down to Evercare. So, Doctor, that said, for the listeners out there, how can the listeners contact you at Evercare Hospital?
Okay, so Evercare Hospital is located at number 1 Admiralty Way / Bisola Durosimi 80 Drive, Lekki Peninsula Scheme, here in Lagos. Our website is www.evercare.ng. You can also send us an email on info@evercare.ng.
All right.
Evercare can also be reached on telephone 0813 985 0710.
All right, Doctor. Thank you so much for being a part of the program. And I look forward to seeing you again for the screening, and also coming back here and having conversations amongst other things.
Thank you, Kayode. And thank you, our listeners.
All right, listeners, thank you so much too. Lagos, stay close to your radio. There's more to come. Don't forget, this is the smoothest style on Lagos radio. Of course, the Drive Time show is what you're listening to.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.